This is Alex. In this video, I am going to teach you a topic is intubation or a endotracheal intubation. So this topic is very useful for the junior doctors and the nurses who are working in ICUs and emergency areas. What is a intubation? Intubation is a emergency procedure. It's a life-saving procedure, we can say, when a person is not able to take the breathing spontaneously. Okay, in such cases we will a doctor insert a tube into the trachea directly, okay, through a mouth, and he will connect the tube to the ventilator. So ventilator gives the breathings. Okay, this is a procedure called endotracheal intubation. So when endotracheal intubation is required, and what are all the things to be kept ready for doing this procedure, what are the drugs needed, all these things I will just list it down in a brief way. Okay, please try to follow me. So what are the common indications for doing the intubation? Okay, so these are the some of the indications for doing intubation. Airway obstruction, when a person's airway is obstructed by any foreign object, okay, any foreign body, when the airway is blocked by any object, then the person may not take breathing spontaneously. Okay, in such cases need a intubation. Okay, and injury or trauma to the neck. Okay, so in a injury to the larynx or pharynx or in a trachea, okay, or in a neck region, so then he needs a intubation. And in cases of cardiac arrest, okay, cardiac arrest means when the person's heart is completely not working, okay, then stop. Okay, in such case, then loss of conscious, when person's conscious is not in a good condition, okay, when GCS score is very low, and need for surgery, when patient required a surgery, and respiratory failure cases, and risk for aspiration, when patient is in a risk of aspirating, when his swallowing reflex is not good. Okay, in such cases intubation required. These are the some of the conditions. Okay, so in such cases we will do the intubation. So for doing intubation, what are the equipments to be kept ready? Okay, so as a nurse or a doctor, before doing the procedure, you need to get ready with all these items. Okay, first one is laryngoscope. Okay, a scope, okay, which visualizes the oral cavity and visualize the trachea, okay, for inserting a tube through the mouth. Okay, so that is called laryngoscope. Okay, with the blades. Okay, blade sizes will be different, like starting from the 1, 2, 3, 4, like this will be there. For pediatric, different size of blades we will use, and adults different size of blades we will use. Generally for adult male we will use number 4 blade, and for female 3, based on the neck size. Okay, that is the blade sizes, like for 3, 4 for adults, and 1, 2 for infants or children's. Okay, and the next thing to be kept ready, ET tube, endotracheal tube. So these tube will insert into the trachea through the mouth. Okay, that is called endotracheal tube, ET tube. This is also available in different sizes. So depends on the age or a person's neck size. Okay, we will use different sizes. Okay, for adults commonly we will use males 7.5, 8, 8.5 for males, and for females we will use like a 6, 6.5 and 7, 7.5 also. Okay, that is for adults. For infants or children's, okay, 3, 3.5, 4, 4.5, 5, 5.5, like this sizes. For neonates different sizes, and children's based on the age and neck length. So we will use different sizes of the tubes. That is a ET tube and ET tube sizes. And next, stylet or a bougie. Bougie also will be there. Okay, bougie. So this allows to keep the endotracheal tube easily directly into the trachea. So that is an equipment that should be kept ready. Stylet and bougie for adults commonly will use, stylet for children who will use. And Megal's forceps also for allowing the intubation easily. Megal's forceps kept ready. And airways, good airway also you can say, or oral airways. Okay, it is also available in different sizes. Okay, 2, 3 like that. Okay, and color codes also will be there. That airway, oral airways also kept ready, and 10cc and 5cc syringes also kept ready for inflating the ET cuff. Okay, for inflating the ET cuff. Cuff will be there after inserting the tube into the trachea. Then we need to inflate the cuff. Okay, so syringe to be kept ready, and surgical gloves. So because this is a sterile procedure, we need to wear the surgical gloves, and ambu bag with mask. Okay, this is very important. Ambu bag with mask connected to a oxygen if you are in a hospital setting. Okay, ambu bag with a mask, and suction catheters to be kept ready for doing this suction, clearing the airway, oral cavity. Okay, removing the secretions, and suction tube with anchor tip. Okay, anchor suction set to connect to the suction, central suction port, and suction catheters also kept ready, and tie or plasters. Okay, ET ties will be there to secure the ET tube. Okay, so to tie, so we needed ET plasters or tie. So these are the minimum equipments kept ready for at the bedside for doing the intubation procedure. Along with this, oxygen should be kept ready. So central oxygen supply, or at least oxygen cylinder should be there. Okay, central oxygen supply definitely should be kept ready. So these are the minimum equipments kept ready for at the bedside, and where you are going to connect to the ventilator before doing procedure. Only ventilator should be passed by the system check, and circuits to be connected. Okay, check the ventilator circuits. Okay, connect the HME filter also. So kept everything ready at the bedside, then go for the procedure. Okay, so and what are the drugs also needed when we are doing intubation? There are different types of drugs we will use. So in this for pre-treatment we will use some of the drugs, and for during procedure I mean for the induction we will use some of the drugs, and for sedating, for analgesia, anesthetic effect we will use different, and paralyzing. Okay, relaxants, different drugs are there. Okay, don't get confused. Here I listed out some of the commonly used drugs, okay, which we will use in the intubation process. Etomidate, ketamine, midazolam, propofol, scopolamine, vicronium, rocronium, fentanyl, and there are other some drugs also there, but some these are the commonly used drugs. So I will just tell you briefly what is the indication, I mean action of these drugs. Okay, in another video I will explain you based on the body weight how much dose should be given, what is the indication, contraindication, all those things. Etomidate, ketamine, midazolam, propofol, these are the commonly induction drugs for the intubation. Okay, these will sedate the patient. Okay, etomidate, ketamine, based on the patient condition, clinical condition, we will use different drugs. Out of these 4, anyone can use: midaz, propofol, ketamine, and etomidate. And scopolamine is used for the relaxant. Okay, muscle relaxant. Okay, it will relax the respiratory muscles. Okay, then it will allow the tube to pass easily. Scopolamine, succinyl scopolamine you can say. And vicronium. Vicronium is a paralytic agent. Okay, relaxant and paralytic agent. It will paralyzes the respiratory muscles on the neck. Okay, so that also allows the tube to pass easily. Vicronium or a rocronium also coming under same category. And fentanyl, it is an analgesia. Okay, after intubation for the management we will connect this fentanyl drug also. So these are the commonly used drugs, and when to use. Okay, usually if you observe a intubation, definitely this procedure has to be finished within the 10 minutes. Okay, within 10 minutes we can divide it as a 7 stages. Like a preparatory phase, it has to be finished within the 5 minutes. Preparation coming under, so you need to define the indication of doing intubation and get ready with all the equipments. Okay, all the things takes place coming under preparation part. It takes 5 minutes at least. And before that, before doing intubation, do the hyperoxygenate the patient with the either ambu bag or by the direct giving oxygenation or direct oxygenation. Pre-oxygenation is one of the part. Next, pre-treatment also give in case of road traffic accidents, in case of head injuries. Okay, so to decrease the ICPs, we will give some injections, that is coming under a pre-treatment. Next part is coming under paralyzing and induction. Okay, paralyzing and induction. So in this situation we will sedate the patient. Okay, we will kept ready for the patient. Oxygenation will give for continuous 2 minutes, and induction we will sedate the patient within 1 minute. You have to do the intubation and kept ready. Check the position and placement. Next, post induction. Post induction coming under keep the patient in a sedative state, means to reduce the anxiety level of the patient, to reduce the pain. So these are all the stages coming under the intubation. Okay, so that's all for today. If you like my content, please like, share and comment. In the next video I will come up with the detailed explanation of the drugs. Okay, thank you so much.